कॉर्निया वेट करो इन ट्रोकार Why is this a pterygium or not a pterygium, or what it is? First question. कोई तकलीफ हो तो बताएंगे, अब ऑपरेशन शुरू कर रहे हैं. Nobody appreciates good anesthesia. अरे इसको ऑन तो करिए आप यहाँ पे. आ गया. एयर पे तो नहीं जा रहा है? नहीं. ठीक ठीक. So first thing which you do after putting your infusion line is you switch off the light and then you look for the visibility of the cannula in the correct vitreous space. And the visible sign which you depend on is there should be a metal cannula shining, and then you switch on the irrigation switch and your IOP will build up, and this is important for you to make a very nice sclerostomy which should seal by itself at the end of the surgery. But this is possible only if you have a turgid eyeball. Again, you have nearly a 0-degree angle of entry, maybe 10 degrees or so. Good. If you have white vitreous opacity after a hemorrhage, that means there is no active bleed. It is all stagnant, collected, degenerated blood, which is a good sign because then you don't expect a re-bleed tomorrow or during the resting period. Cornea wet करिए, biome लाइए. You do the anterior part first because once you place the biome in view, then you will lose the view of anterior segment. So if you have any media opacity, then you take care of that before you switch on the biome. Focus. Bus. So this would not have focused the retina yet, but it has focused the mid-vitreous cavity, which is the concern right now. And usually in a situation like this where you don't have any view, you usually proceed into the nasal quadrant first. Why? If you have absolutely opaque media and you are doing media clearing surgery, then you go toward the nasal quadrant first. Any reason? Shivani? Which quadrant would you prefer? Or no preference? अरे कुछ तो जवाब दो. मतलब I have given you all possible options. So you mean no preference? No, but don't you expect that there may be a detachment? Media is opaque, you don't know. And what if you cut macula? So this is a safe strategy. You start from the nasal quadrant so that even if there is a detachment and you are supposedly cutting retina at some place, then you are not injuring the central retina. That is always possible. See, this would look like retina, no? मतलब अरे थोड़ा लेंस वाइप करिए. Now this is the effect which you will see on in winters. You will see the deposition on the. This is vapor being deposited, condensation because of the patient's surface evaporation and breath coming from the nose. open his nasal channel. So if you don't allow the breath to go there, it will come here and it will get condensed over the lens. And it will cause poor vision recurrent. So one way is that you turn on the AC in your OT, which will also dehumidify the air. Another option is that you put a fan which blows over the lens so that there is no condensation. And the last option is that you have what? An assistant who will keep on wiping it. अरे तुम लोग घड़ी घड़ी बीपी नापते क्यों? अभी तुम्हारा MS का जब एग्जाम होगा तो मैं नापूंगा तुम्हारा बीपी, और फिर मैं पूछूंगा एग्जाम देने लायक हो कि नहीं हो, और एक कंडीशन होगी अगर बीपी बढ़ा तो एग्जाम नहीं देने दिया जाएगा। किसी का ऑपरेशन लगा दिया तुमने, उसे मालूम है कि मेरे आँख का ऑपरेशन होना है, तुम्हें क्या लगता है उसका बीपी कम हो जाएगा? फिर क्यों बीपी पे इतना चिंता करते हो? अरे कॉर्निया तो वेट कर दो। We have a proliferation here which is very reasonable occurrence because there is a large area of avascular or hypoxic retina, you can see, and this is also causing traction and it has caused the bleed. But now the anti-VEGF had taken care of the vascular neovascularization, and so that we are now left only with a scar and a avascular retina which will not function. So the gentleman will have inferior scotoma. We cannot help that. लगाइए भाई हमारा प्रोब लगाइए लाइट पाइप वाला, देखें विट्रियस बेस शेप करके आज फिर। So this would have otherwise bled, but anti-VEGF had taken care of this fact and now it is absolutely avascular. अरे थोड़ा जोर जबरदस्ती तो करिए। देखो टूट गया तो डॉक्टर शिल्पी जिम्मेदार है, ये ऑलरेडी उन्हें मालूम है, वो सर कुछ है नहीं, उन्हें मालूम है कि वो कुछ करें ना करें जिम्मेदार वही है। तो शी हैज स्टॉप्ड लिसनिंग टू आवर कन्वर्सेशन। नहीं जा रहा, मुझे लग रहा है ज्यादा ताकत लगा दी तो वो टूट जाएगा, तो उसके लिए डॉक्टर शिल्पी जिम्मेदार। लाइए हम भी देखें। अरे लाइए, ये नया वाला है। yes. अरे इसको पका दिया क्या? नहीं सर, उसमें प्लाज्मा किया, मुड़ गया है। ऑन करिए, ऑन करिए, दब गया है, 50 डिग्री पे दबा दिया गया तो मुड़ गया है, ये पूरा नहीं जाएगा। देखिए एक्चुअली ये ना, देखिए ये वार्प हो गया है, ये गोल था कभी किसी जमाने में, इसको आप लोगों ने दबा दिया। वो वाला लाओ, बड़ा वाला लाओ। पहली बार जो इसको ज़्यादा टाइट पैक कर दिया आपने, दबा दिया है पैकिंग में, तो जब 50-55 पे गया ना तो वो मेल्ट हो गया। इसको किसी डब्बे में रख के करिए जिससे इस पर कोई दबाव ना पड़े। वैसे इसको केवल ऐसे प्लाज्मा पैकेट में ही डाला था। नहीं तो उसमें मत करिए, उसमें डब्बे में रखिए, उसके आसपास का जो मटेरियल है ना उससे दबाव बन गया तो पिचक गया। ये छोटा बनाया था मैंने क्योंकि इसको अंदर मतलब ब्लेड के बीच में जाता नहीं आसानी से, इसकी तो ज़रूरत है नहीं। कटर दीजिए। हाँ बना देंगे। एक्चुअली पीएलए का जो ग्लास ट्रांजिशन टेम्परेचर है वो होता है लगभग 60 डिग्री। 60 डिग्री पे वो सॉफ्ट हो जाता है। और प्लाज्मा जो काम करता है, अरे इस पे कुछ रखो भाई, लेंस को भिगो रहा है। ज़्यादा अच्छा कोर हो गया ना, विट्रियस वहाँ पे गायब हो गया, तो इट इज़ फ्री फ्री फ्लो। इस पे नहीं, उस पे तो कटर जाएगा, उस वाले पे रखो बस। इसको वाइप करिए। Now this will take care of that leakage because it will, पिछली बार मैंने आपको बताया था।
क्या बाउल वहीं पे रखा हुआ है मैम?
फोकस करो। नहीं, बस।
डॉली सुनो, सुनी को एक टॉवल डाल दो।
How nice. Hmm? The globe is getting deformed more than what we want in the nasal part. Such a nice view. Hmm? अरे वो हट गया अभी कॉटन। We'll have to indent from the nasal part actually. I can see this issue. We are indenting the globe too much, and that is why it is causing distortion of the cornea. So we have a poor view, and now it will not happen like this. Maybe there's a lack of space there actually. This may be the role of his pseudopterygium. There's an adhesion between the lid and the globe. Keratoblephron and chyloblephron. Is a history of trauma there? Lao biome lao. Yes, forceps, chopstick. अरे वो लेजर लगाइए, एंडोलेजर.
लेजर दीजिए
ऐसे रखिए.
सर। विट्रियस से नहीं शेयर
कर दिया.
नहीं, अगर नहीं करते हैं तो
हाँ, उससे पोटेंशियल इश्यूज होते हैं. विट्रस बेस बाद में यूजुअली फाइब्रोस करता है, तो इट मे बी अ रीजन ऑफ डिटैचमेंट लेटर ऑन. It's a standard practice to create PVD, and vitreous based shaving is must. If you don't do it, you may have potential issues. So when you, if you do it, it is absolutely desirable. But vitreous based shaving is an issue in itself, because this is choroidal detachment. If your globe will collapse, choroid will come in. Actually, technically, it is globe collapse, but from inside it will look like lens by period. नहीं, लेजर भी है.
स्पेक्स दीजिए.
Don't look now. Not only this cold weather will cause fogging on the lens, it will also cause fogging on my spec. थोड़ा सा आगे खींच लो, थोड़ा सा, बस. And I've seen that when I am nervous, my eyes start sweating. So I, so I start having fogging on the lens. पावर कितना है? 400 कर दीजिए, थोड़ा जल्दी हो जाएगा.
400.
लेजर फाइबर मेरे सामने आ रहा है, इसको जरा लो, खींचो नहीं. प्रोकार कैनला. चश्मा निकालो. कॉर्निया बट करो. Whatever you do, your sclerostomies have their mind of their own. They will leak if they want to leak. They will not leak if they don't want to leak. You don't have any control over them. Now, nobody answered my question that is this a pterygium or a pseudopterygium? Chopstick. एक रिंगर दीजिए. I think there's an adhesion here. You see this? See this? There's an adhesion in the at the fornix. See that space? Normally ये होना चाहिए नहीं होना चाहिए. Should pterygium have that space?
Rope can be passed under the neck into regions, and it does not.
So what does this amount to? Are we able to pass? So what is the needle दे दीजिए.